This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together.
This video will be presented in 11 sections. 1. Introduction. 2. How to get started. 3. Hand hygiene. 4. Prepare a clean workspace. 5. Gather supplies. 6. Use your personal protective equipment. 7. Prepare supplies. 8. Disconnect and discard. 9. Scrub the hub. 10. Pulse flush. 11. De-access the port. 1. Introduction. It is now time to disconnect your chemotherapy. It is important to pay special attention to safety measures when disconnecting the chemo, to not contaminate yourself or your surroundings. We will review how to disconnect from both an electronic pump as well as an elastomeric infusion. Please watch this video as many times as you need. If you have a caregiver who is going to assist in disconnecting a chemo, please have them watch the video as well. 2. How to get started. Your nurse will tell you at approximately what time you should be ready to disconnect from your chemo. You should be monitoring the bag or elastomeric device during your infusion to be sure it is becoming smaller in size. If you have a large volume of chemo left when it is time to disconnect, please call your infusion provider for direction. First things first. Hand hygiene. Practice good hand washing. Washing your hands helps reduce your chance of infection. Use soap and water at first. Make it a habit to wet your hands, apply soap, and lather for 20 seconds. To make sure you are taking 20 seconds, sing the happy birthday song twice. You can use hand sanitizer after you've already washed your hands with soap and water. If you use hand sanitizer, rub a dime-size amount between your hands until they are dry. Never wave or blow your hands to speed up drying. Even if you are using gloves, you must still wash your hands. If you are using gloves, put your gloves on after washing your hands. 4. Prepare a clean workspace. Before we take down our chemotherapy, it is important to find and prepare a clean, dry, hard workspace to set up our supplies. Clean the workspace with a gentle cleansing solution, such as a disinfectant spray or alcohol. You can place the provided sash placemat on top of the workspace. Also, clean the sash mat with a gentle cleaning solution, such as a disinfecting spray or alcohol. Wash your hands. 5. Gather supplies. The next step will be to gather your supplies. Your home infusion agency will provide you with these supplies. If you are missing any supplies, contact your home infusion agency. You will need 2 sets of gloves, 1 chemotherapy gown if a caregiver is going to perform the takedown, 1 hazard zip bag for gloves and gown post-use, 1 large hazard bag for long-term storage, which is reusable, 4 alcohol pads to clean your supplies and hub, 1 saline syringe to flush your IV line after the medication has completed, 1 chemo sharps container to dispose of used pump and pump tubing, 1 trash bag for garbage, and 1 red cap. Place the trash bag close by and the sharps container within your reach. Wash your hands one more time. 6. Use your personal protective equipment. Now don the chemo gown first with the opening to the back. The gown should cover your arms, torso, and at least your upper legs. Tie the ties. Next, put on both sets of gloves, one after another. The first set should fit under the gown's cuff. The second set should fit over the gown's cuff. 7. Prepare supplies. Place an alcohol pad and 1 saline syringe on the sash mat. Pick up your syringe and remove the protective cap from the syringe. Place the cap flat side down on your sash mat. Hold the syringe with the end up and the plunger at the bottom. Pull back on the plunger slightly to break the seal. You will be able to see the air bubble in the syringe. Slowly push the plunger up and let the air bubble out. Once the air is removed, pick up the cap from the table and put the cap back on the end of the syringe. Do not touch the inside of the cap. Place the syringe back on the sash mat. Number 8. Disconnect and discard. Now the moment we've been waiting for, disconnecting and discarding. First, remove the infusion bag or elastomeric pump from the carry bag. Sit the bag or device on the work surface. Inspect to be sure the chemo has infused. If you can't tell or the chemo hasn't infused, please call your infusion pharmacy. If you're using an electronic pump, the pump will beep when the chemo is complete. Stop the pump by hitting the stop/start button. Select yes when the infusion is completed. Power the pump down by pushing and holding in the gray button on the side until the pump powers off. Be sure to clamp any clamps on the tubing. Next, disconnect your medication tubing from your IV line. Grasp the end cap of your IV line with one hand while using your other hand to unscrew the medication tubing. Do this until the tubing is disconnected from the end cap. Do not remove the end cap from your IV line. The end cap protects your IV line from bacteria. Cover the end of the chemo line with the thin end of the red cap. If you are using an elastomeric device, place the entire device into the chemo sharps container. If you are using an electronic pump, pull down on the lever on the side of the pump and cassette to unlatch the cassette from the pump. Remove the cassette and discard the cassette, tubing, and bag in the chemo sharps container. 9. Scrub the hub. We will now scrub the hub. Hold the end cap between your fingers and scrub the hub, which is the tip of the end cap, for 15 seconds with an alcohol pad. Do not put down the end cap. Discard the alcohol pad. Pick up your saline flush syringe. 10. Pulse flush. Remove the cap of the syringe, being careful not to touch the end cap that was just cleaned with alcohol. If you do touch or drop the end cap, scrub the hub again for 15 seconds with a new alcohol pad. Attach the saline syringe to the center of the hub and push and turn clockwise until it is attached. Now push 1 to 2 mL of fluid at a time until the syringe is empty. Discard the syringe in the chemo sharps container. Clamp your IV line. 11. Deaccess the port. Remove the dressing from your skin and the port needle insertion site. Carefully remove the dressing tape around and over the port needle by removing the dressing from all sides first. Then hold the needle down when removing the dressing from the port needle itself. Be careful not to pull the needle out during the process. Now it is time to remove the needle itself. If the needle has yellow or black plastic wings, pinch the wings together with one hand while stabilizing port with the other hand. This will pop out the needle. Discard the needle in the white chemo bucket. If you have a clear or white plastic port needle, hold the white circle against your skin and pull the nub away from the chest. This will remove the needle. Discard the needle in the white chemo bucket. It is now time to remove your PPE. First, remove your gown. As you take the gown off, fold the outside inward to keep the inside of the gown on the outside. Be careful not to ruffle the gown because this could spread particles into the air. Place the rolled up gown inside the clear plastic bag. Remove gloves, turning the gloves inside out as you remove them. Place the gloves inside the clear hazard bag and close the bag. Place the closed plastic bag into the larger hazard bag and close it using the zip tie. Keep the large hazard bag stored In and out of the way area. A closet, garage, or shed all work. Wash your hands one final time. Congratulations! You have now completed your chemotherapy takedown.